When we think about innovation in Montgomery County, there's a clinical component and an operational component. So clinically, we're working with our Department of Clinical Services on a few different components that can help us look at EMS in a different avenue in a pre-hospital setting, one of which is community paramedicine and MIH and how those two correlate together. So we think that from an MIH standpoint, there's a clinical component that we can provide some pre-hospital care as we think about what ET3 looks like and what we can do in a patient's residence to maybe perhaps keep them from going to the hospital. As we also correlate that with community paramedicine, it's in a social work aspect. So we have a social work component and a clinical component that we want to merge together in Montgomery County to help our patients who perhaps don't have the means to access health care in that manner. So we're looking at insulin and lab values in the home, different antibiotic treatment pathways, so that we can work with patients in their residence. Operationally, we're continually to look at how we can maintain our crew's health, both mentally and physically, and implementing our fatigue risk monitoring system, which now we've had in place for 2 years. I think that we've had it in good standing. We've been able to monitor fatigue, but now that that process has been in place for 2 years, we're looking at ways to go back to the drawing board on fatigue and really ensure that we're monitoring how our crews are rested and what we can do to ensure that moving forward as volume continues to increase, that we're keeping our crews rested and giving them an opportunity to have some downtime on shift to reset, catch up on some documentation, refresh, and then get back on the streets or run calls in a manner that allows them to be rested. So this is my second year to come to this conference, and as an organization as a whole, I think that we need in Texas a group that can speak one voice for EMS in the state. And I think everyone across the state does well with EMS and fire and working together, but we need to come together in a collaborative manner, and I think this organization has the means and really the power to do that. We don't want to be so fragmented that we're all doing our own thing in different silos. Texas is one of the leaders of EMS really in the country, and we need to have a united front where we can all collaborate together and push EMS further.